Welcome to Bench to Bedside, a weekly series of live conversations about recent advances in cancer, from the research bench to treatment at the patient's bedside. And now, your host and the director of the University of Kansas Cancer Center, Dr. Roy Jensen.
Hi, I'm Dr. Roy Jensen. Thanks for joining us for today's episode of Bench to Bedside. With me today is Dr. Gary Doolittle, medical oncologist with the University of Kansas Cancer Center, medical director of the Center for Telemedicine and Telehealth at KU Medical Center, and medical director of the Midwest Cancer Alliance, which is the outreach network of the KU Cancer Center. Today we're going to discuss TeleHospice, a project that enhances and extends hospice care to rural areas of Kansas. So tell us about the TeleHospice project. How did it get started in the KU Cancer Center, and how does that benefit our patients?
Yeah. Actually, the first telehospice project that we launched was way back in 2000, 2001. And it's basically the use of telemedicine technology to provide health care for patients in the home. And in this setting, it's to provide care for hospice patients in the home. We struggled a little bit at that time. The technology wasn't as sophisticated as it is now. We had some trouble with provider usage. The rural sector adapted pretty well to it, but our urban programs didn't adapt so well. Flash forward another 15, 18 years. We're living in an iPhone world, and we're used to FaceTime, and the technology barriers that we experienced early on don't exist now. You couple that with a real dynamic hospice in the northwestern part of Kansas, and we got together again and decided that we would take on an additional project, a new project, using newer state-of-the-art technology.
So how does a telehospice visit look like? What's involved in that?
Okay. We actually use iPad technology. We just put iPads in the home, and the providers will be at their site, whether it's the office or if they're at another site, hospital or nursing home, and they literally will FaceTime each other or call each other. We have a real dynamic project coordinator, a guy named Adam Lomanek, who has figured out how to make the iPads work such that you can literally call without scheduling it. So much like what we do in FaceTime. And it's a conversation using the technology that's focused on hospice-related problems.
So I suspect that a critical part of launching this endeavor was making sure that you had a great partner. And how did you go about selecting the hospice organization that to partner with in this endeavor?
That's a good question. We approached several hospices early on and met with them and kind of pitched the program, what it could look like, what were the kinds of things we were interested in providing as a service, and with each service the kinds of research questions we wanted to try to answer. And one quickly came to the surface as a partner that would really embrace the project and move forward. We're working with Hospice Services Incorporated in the northwestern part of the state. Their leadership, really dynamic, a woman named Sandy Coleman, really has a vision for hospice care and has really spent her whole professional life providing hospice services in the rural sector. Their hospice covers 16,000 square miles in the northwestern part of the state. They have nurses that are placed in 6 different communities within that particular area. And I think they could see a vision for this. The technology could be used particularly in acute problems. If a patient called and was having pain, the nurse may be looking at an hour and 15-minute drive to get there to do the assessment, or could use the telehospice technology, assess the patient with the idea that she would eventually get in the car and get to that patient. So they have geographic barriers they're trying to grapple with. They have weather issues. I mean, trying to assure that you can see patients in a timely manner isn't always a given when you have the distance that they have to travel to make those visits happen.
So if you're just joining us, we're here with Dr. Gary Doolittle, and we're talking about a project known as TeleHospice. Please remember to share this link with people you think might benefit from our discussion. Use the hashtag BenchToBedside. So, what would you say are the major benefits of telehospice visits to patients and their families?
I think it really comes down to access, and in some circumstances, it's immediate access. If there's an acute problem, you can call in and set up a visit electronically, but also access over time, I think is something that really benefits patients and is, in the hospice world, the patient is center and everything we do revolves around the patient, but there are caregivers in the home that need a lot of support. If they have a problem, their family member is facing a problem with pain or some type of symptom, they're the ones that are there trying to manage it. And if we can establish a video call and help them through an episode that's acute, or if we can establish a video call and just support them, because it can be a very isolating experience. You're in the home, you're not medical, you're trying to care for your loved one. It's a huge responsibility. And knowing that you have that kind of connectivity is a real benefit. Patient center, family members benefit from it as well.
Mm-hmm. So turning that question around, how does this project in telehospice benefit providers and the health systems that utilize it?
Yeah. Again, a really good question. I think people that gravitate to hospice and they want to be hospice providers really want to make sure that patient gets everything they need exactly when they need it, right? So this gives them access that's immediate. It enables them to make additional visits, right? If they plan on going out once a week and it's an hour and a half drive one way to get there and an hour and a half back, they also know they can supplement that visit with a couple of calls in between. So it's very satisfying, I think, from a provider perspective. It's not just nurses, it's medical directors that are part of the hospice programs, it's social workers, it's chaplains. And if you don't think you can be a chaplain over telemedicine, just turn on your TV Sunday morning, because there's it's a natural in so many ways. And again, the windshield time lessens, and that's huge. And I think it's really important to talk about cost because rural hospices are struggling. They're struggling just having providers. They're also struggling with fiscal constraints that all organizations struggle with. But their travel expenses alone are huge. Because you're sending a nurse in a car, hour and a half windshield time to and from, a medical director that has to see these patients, typically in person every 3 months minimum. That's very expensive to have a physician, behind the wheel of a car. And then there's a whole mileage issue. The mileage budget for hospice services incorporated is really high, and this enables more access and hopefully will help some with cost.
So have you seen any potential for unique applications of this telehospice project?
Yeah, I think for this one in particular, I think the chaplain service is really unique. They're also using it for bereavement care. Part of the whole hospice philosophy is you care for the patient through maybe a difficult time at the end of life, but then they also play a supportive role in the bereavement period for caregivers and family members, and they can use the technology to connect and provide that service, again, saving the travel time that goes with it. I think that's unique. I think now with the ubiquitous nature of iPhones and iPads, we've had family members from all around the country contact their loved one that's on hospice in the northwestern part of the state, so they can connect from New York to Phillipsburg, Kansas, and connect at a time when the nurse is actually there with the patient and offer input and give them an update on it. I think that's pretty unique as well.
So are there programs in telehospice outside of Kansas?
I do know of programs. The ones that I know of most are those that are part of research programs. I don't know of services that are just automatically offered. I know it's coming because the way our healthcare structure is now and the expense attached to hospice services. I know in the private sector there's tremendous interest in this. But I think the hospice services program is really a unique one.
So building on that, what are the plans, or are there any plans to extend this program to other hospice care organizations?
Oh, well, you know, I'm a medical oncologist and a former hospice medical director. I would really like to see the technology diffuse. We'd really like to try to convince payers that this is a reasonable service and get the service paid for in that way. In the Medicare world, the reimbursement structure is per diem, a per day service, and just legitimizing this service as part of that, I think, is going to be really important. Yeah, I'd like to see this technology diffuse to not only hospice patients, but patients that are confined to home, and maybe dealing a little bit with the isolation factor, but also dealing with the management of chronic disease in the home.
So as we approach the end of today's session, what advice do you have for viewers who may be interested in learning more about the telehospice program?
Right. You know, I'd be really happy to talk to anyone that has an interest in this, and you can get hold of me. My phone number is 913-588-4761. Very happy to talk with you. You can email me, gdoolitt@kumc.edu. Really happy to talk to you. Would love to see this service expand in the state.
Well, thank you. If there's any lesson that I've learned from my own experience with hospice, both of my parents were on hospice the last few months or weeks of their life, and if hospice workers ran the world, all of our problems would go away. They're really a special group of individuals that are just, they're angels on earth. Yeah. There's no doubt about it.
Couldn't agree more. I had the same experience with both my parents, and I'm a medical oncologist physician, and you cannot imagine how much I depended upon their insight and their assessment when they come in the home and let me know how things were going. And this is what I do, right? But when it's your own family, the intensity attached to that is like no other, and to have access to that kind of service is huge. Every Kansan, any patient that needs hospice services should have that kind of immediate access, I think.
Well, thank you so much, Dr. Doolittle. That's it for today. For more information on Dr. Doolittle's telemedicine work, please visit the telemedicine and telehealth page on kumc.edu. We appreciate you joining us. Thanks for watching.